Hi everyone, welcome to Demystifying Medicaid with Dr. Krish. My name is Krish Subramanian. I'm a pediatrician. And the amazing thing about people is that they always make time for their kids. So I saw a patient with an ear infection once. I looked in the ears, I gave some stickers, made them feel better, prescribed the antibiotics. But out in the corner, I looked at Mom, and Mom was real pale. And she said she felt really awful. I said to her, we should get you seen by someone. Oh, doctor, I can't. I don't have insurance. Going to a doctor is no fun. I'm a doctor and I don't like to go to the doctor. But we all will need a doctor one day. And our hope is that you won't end up in a situation where you either can't afford it or are scared and don't go get the care you need. Even for those who don't have insurance, though, they may not have an employer, there are possibilities out there for health insurance. For folks over 65, we have Medicare. And for folks who may not be employed currently or can't afford insurance, there are options like Medicaid. But there are myths out there about these programs. What about these public insurance plans? Some say it's free, so it can't be good. Some say you'll have to wait. Some say you won't be able to get your medicine. These are a number of the myths out there about public health insurance. Today, we're going to talk about those myths and try to dispel a few of them. Being in the presence of people's stories is a true gift, and today we are privileged to hear from a few friends who have managed to make sense of and navigate this really complicated healthcare system. And so I get the privilege of introducing to two of my friends, people who have lived experience navigating and overcoming health insurance and the health system. I get to introduce you to Mr. Tommy White and Mr. Randy Flowers.
Right.
Appreciate you both being here. Thank you for taking your time to share your story.
It's a pleasure being here.
Thank you.
Honor. Tommy, you're not from Minnesota.
No.
Where'd you grow up?
Mississippi.
Mississippi. And how'd you find your way to Minnesota? It's cold here.
Well, got a lot of family, they travel different parts of the state, from Illinois, Michigan. Had a sister came over here back in the 90s, in the late 80s, in the mid-late 80s. I came up back in the late 90s.
Yeah.
It was the early 90s, really. I left and I come back. And so I've been up here since then. In 2019, I was feeling kind of, my blood pressure. I didn't have no medicine, so I went to the shelter down there at Harbor Light, downtown Minneapolis. And that's how I got off into independent help. And it went from there. And I got everything that I needed, from the glasses, x-ray, CAT scan, you name it, therapy. I'm still doing it now. I go to Whitaker. Down on Tuesday, we do the air plugs. Called battle punch air plug. They put them in, they relieve chronic pain through your body.
Oh my.
Yeah, mental stress, they do all that. Yeah.
So you were at the shelter downtown Minneapolis, and you began to notice either some health concerns, some worries. I can imagine we have a lot of neighbors out there listening to this right now who are in a similar situation.
Right.
Either not housed right now, or having something bothering them. And I can only imagine the fear, right? The fear and the worry and the anxiety associated with that. What would you tell those folks, or how would you guide them in terms of taking next steps? Because it sounds like you figured out a next step. How did you do that? How did you make that next step?
Well, first you got to go forward. You got to trust yourself to go there. And once you sit down and talk to a receptionist, you'll see a nurse. They check your blood, then they'll give you a doctor. Just keep going, and it's good. You get medication, all that, get everything you need.
When you heard that you were signing up for Hennepin Health or Medicaid generally,
Yeah.
what was your sort of perception, or what did you think about it coming in? Because
Well-
most people don't like health insurance,
Well-
and then most people don't think about public health insurance. They're like, oh,
Right.
that's
Well,
not so
you
good.
know, well, I asked questions before I done it, and I was led to, you know, everything is gonna be like, if you don't have the funds, still go. You still gonna see a doctor. They still gonna give you medicine. They gonna work with you. What I'm saying.
Yeah.
Until you get where you need to be on the medical side. If not, you can keep going, and they're gonna keep giving you a resource. You keep getting all the resource you need, and so that's what I did. I'm still doing it today.
You know, you have now been on public health insurance for a few years.
Since 2019.
So 5 years through a
Right.
pandemic, right?
Yeah. All that. Yeah.
How has it benefited you? How have you used it? What are the ways that it has made some difference in your life?
Well, it made a lot of difference because I could get the proper medication I need for the blood pressure, chronic pain, from the vitamin pills you need, vitamins, you know, all different eyeglasses, foot doctors, you know, like I said, it's the full deal, you know.
Yeah.
You can't go wrong, you know. You can't go wrong.
Yeah, and have you found that the public health insurance that you're on, has it been able to cover the things you need? Do you still have to pay a lot of money out of pocket? How does it work?
It's covered.
Huh.
Yeah, the public health insurance cover.
So the medicines,
You know,
the
sometimes
visits.
sometimes you might have to pay a $3 fee. That's it. But all the other stuff is like the medicine, all that. It's gonna come free. Bus cards, rides.
Yeah.
You need to get a ride here, they'll just call. If you need a bus card, go right now. You can get a bus card.
So they'll help with transportation as
Yeah.
well.
Yeah, they help with all that. Yeah.
Food.
Food. You
Food.
need food. Yeah, give you food too.
Now, one of the questions, I think there's a lot of people who would have been in your situation in 2019 and said, I'm scared, right? I'm
Right.
scared of, one, going through the bureaucracy or trying to figure out health insurance, two, going to the doctor, right? Like that's sometimes a big challenge for
Right.
a lot of folks, is the
Yeah.
doctor is a fearful place. What advice, what tips, what experiences would you have for folks feeling that inside?
Well, like I said, you gotta put your fears aside, you know, and step forward. If you don't step forward, it's not gonna come to you. You gotta go out. You gotta go out to it. Just laying around, it's not gonna come to you. You're gonna miss an opportunity. What I'm saying.
Yeah.
So you gotta get out there and let them know that you're trying to get your health right, and they will help you get your health right. You know, if you don't try it, who gonna try it for you?
Fair. Have you found that there are people there to walk with you?
Yes. Yes.
Well, I'm so happy that you are. Do you think you are healthier than 5 years ago?
Yes. Because I can get the proper medication that I need. You know, it ain't gonna be too low or too high. It's just gonna fit your body. You know, only your body like that.
Well, I take your message away that the first path to health starts with a step, and you got to take that. You got to take that step.
Right, yeah. You got to take it.
Well, Tommy, thank you so much for sharing your story. I really
All right,
appreciate
thank
it.
you too.
And our mutual friend Randy is here too.
Randy.
And so, Randy, thanks for being in conversation. Thank you for being here today. Really appreciate you.
No problem.
Randy, you have a real interesting story about public health insurance, and then after public health insurance, and then also the work that you do on a daily basis.
Exactly.
You have a lot going on. Tell me, are you from Minnesota?
No.
Where'd you grow up?
I grew up in Illinois.
Okay. And how'd you find your way to Minnesota? I'm telling y'all, it's cold. It's cold here.
I found my way to Minnesota because I'm the middle kid, and my mom got sick, and everybody else had families. And my daughter was grown. So I came here to Minneapolis, actually, to support my mom. She had cancer.
I'm so sorry.
So I came here to take care of her here in Minnesota.
Before we delve two steps into your story, your mom went through a difficult health experience, right? Cancer is
Yes.
an awful experience. When you were supporting your mom, what were your perceptions of this health system? What were your perceptions of the way that this medical world works?
My initial perception of it was she was in surgery 19 hours. And that team that worked on my mom saved my mom's life. And when I walked in the room and I looked at her, and I was just looking around, and it was just people busy taking care of her. So I needed that. It helped to de-stress me. Can you imagine the ride to Minnesota?
Yeah.
And I was just in awe because the people, you can do a job, and you can tell the way a person do a job. If you love to cook, it reflect.
Yes.
They love to take care of my mom, and it reflected because after the surgery, everything went well. She had follow-ups, and it was actually different. And because we're in Illinois, it's a totally different system. And I put that book on the shelf. But when I was looking at this, I was like, who's paying for this?
Yes.
You know? And my mom was like, well, I got insurance and stuff. And it was remarkable. I am in debt to the people that took care of her, because they brought her through that, and we was able to bring away, and we was able to experience my mom for 7 years after that. She stayed on this earth. So I was really impressed with the care, the level of care. Like I said, you can do a job, but you can tell they really cared.
Yes.
You know, and yeah.
Well, thanks for bringing it home, Randy, because we talk about health insurance, we talk about health care, but the care is
important.
what is most important, and the love is what is most important. So I appreciate you bringing us home on that.
Right.
That you came up here to take care of mom, which I think we oftentimes underestimate how much of health care is family care, and so hats off to you for doing that. That's, you ended up on public health insurance. Tell us about that journey. How did you find your way to public health insurance? How did you find your way to health insurance? What made you walk down that pathway?
Well, actually, I wound up homeless when some stuff that was going on technical in the family, and I wound up homeless. So I was living a homeless life. I had to I made sure my mom was fine, but I had to take the responsibility to take care of self. And just so happened, actually, I was living in the streets, and I was drinking. I was drinking to deal with just the shock of I left from my home to do this. And there was a lot in there, but what happened was I wound up getting really sick. And I went to the emergency room and HCMC, and the I never forget it. He came in the room and he looked at me and he said, "You got to stay here." He was looking at some tests and stuff in the red, and I was like, "Whoa!" And then next thing you know, he came back and he said, "We got to take you to surgery." So I had a rupture in my stomach and stuff from the alcohol, and they took me in there and I went through surgery and stuff. And when I got out, and I'll never forget how that nurse looked. The nurse looked at me and she said, "You have nowhere to go, but you have us. Give us, your phone number. We'll stay in contact with you. We'll make sure you get your medication," and stuff like that. And that was a turning point for me, because it was like, man, I knew that they really, once again, they cared. And they would call me and say, "Hey, you need to come follow up," and they made sure that the stitches was out and stuff like that. So that system interests me, because I was like, wow, they said that Minnesota, it has a really good healthcare system. I'm actually experiencing this. So I had to lean on that probably like 6-7 months. But they followed up and they helped to get me. I wasn't healthy, but I was healthy enough to function properly living on the streets.
one thing that both of you have brought up is that you were in situations where you were unhoused, that you didn't need to have a home, you didn't need to have money necessarily, cash on hand,
Right.
to get the care or the health insurance. And I think that, we have neighbors out there who may be in that situation. I just want to make sure that that they hear that, because both of you stepping through that to find it is a big deal.
Yeah.
So, Randy, when you got, you went through the hospital and then they put you on Medicaid, right? They put you on Hennepin Health.
Yeah.
What were your perceptions coming in to Hennepin Health? What were your perceptions of what I can do with this?
My perceptions, actually, I was sold. Because imagine being homeless, but a lot of the homelessness within me, I felt like nobody cared about me. So when I would go to the visits at the hospital,
Yes.
that would soothe my soul in a way, because I knew that they cared about me. I knew they were seriously would be there for me, and they made sure that they followed up. Like when the nurse said, they actually called me and said, "Hey, how you doing? Or do I have an appointment?" "No, we're just checking to see if you were okay." I'm homeless, so
Yes.
that meant a lot to me, and it still do.
In your time that you were on Medicaid, you were on Hennepin Health, were you able to use it to get the things you need, or did you find that there were sort of barriers or blocks that you couldn't do?
The things that I needed personally, there wasn't barriers. I like how he put it with the $2 or $3.
Yes.
And they don't really enforce that. Okay, let's put that on the table. They're not going to say, well, you owe $20, you can't get your medication. They don't do that. You got people.
Still to get it, though.
They're still going to make sure that your level of care, what you need, that's what you'll be able to get.
Yeah. And actually, it's kind of cool, because some of the newer stuff in the last couple of years is that there are no co-pays for most of our Medicaid, right? Like there's just no additional dollars necessary. It just goes through, which is a big deal and that's not every plan. That's not, but it's most folks, and it's a big deal.
Yeah, but they still let you see the doctor. You still see the
You
doctor.
still get the care. You still get the
Ain't nothing gonna
respect.
change. You still gonna see them.
Yeah.
Tell me about peace of mind. Tell me about, did having coverage or did being in part of this healthcare system, Hennepin Health, Hennepin Healthcare, Medicaid, did that do anything for your peace of mind?
Of course. Me, personally, I like I don't know why I'm stuck on this, but the book on the shelf.
Yes.
Right.
You know that book is there, you know that it's solid, you know the information is within that book. It's the same thing with the health care that I received. I knew that everything I need was right there, and that wasn't something I worried about, as far as being homeless, because where am I going to sleep tonight? What am I going to eat? But health care was never an issue because it was always there. I knew that if something happened to me, they'll take care of me.
Yes, sir. You're no longer on Hennepin Health. You're not on Medicaid.
No.
You are on a different insurance plan, a private insurance, commercial insurance plan. Tell me about that transition, about moving away from public health insurance. How did you make that transition, and then what are you doing? What are you doing now?
I made that transition actually. I said, I made a personal vow to myself that I was helped, and I would show love through my homelessness, and I'm going to do the same thing. So what I did was I joined the organization and do street outreach. And as a result of that, I transitioned into the field of helping people, the same people that was out on the streets like me. And the healthcare insurance that I work, the organization I'm currently working for is amazing. One of the things that I can say as far as with there's title differences, but the level of care is not different. You see what I'm saying? Hennepin Health, private insurance, different titles, same thing. Same level of care, same level of love. And I have to say this, actually I worked through the pandemic. And being a street outreach worker, I'm out there on the streets daily, and I'm seeing that first it was that moment of uncertainty. But I can truthfully say this, and statistical data will back it up. Had it not been for Hennepin County, a lot of people that were homeless would have been dead. The model, the level of care, how they, when he was talking about food, they were giving food. They were letting people sleep in the emergency room. You know what I mean? It was certain things that they say phoniness. You can't act. You can't make this up, and you can't act.
Right. Yep.
And for real, I had our team at that time. Our team, had we not had that support, we'd have been done. And they made sure at the end of the day, that, like I said, what the people that was making and that was at the top, they came down and they mingled with the common folks, and they made sure that that system worked. And it had, with that support, we did actually, our team went through the whole COVID and nobody on the team got COVID. And how we were getting the support initially was we would watch what HCMC put out as far as COVID protection and how to do it. They came. Oh my God.
That's amazing. That's amazing. You know, what I'm hearing is that for some, that moment of healthcare intervention, that moment of love, is a pathway to better health.
It is.
And for some, like yourself, Mr. Flowers, it's a pathway to a new adventure.
Yes.
It's a pathway to a different life in some ways.
Right.
And so I really appreciate you sharing. Randy, we have neighbors out there who are in that moment. They're either in the hospital right now. They're struggling, finding a place to sleep tonight. Advice for them. Advice for them in this moment.
In this particular moment, one of the things you have to do is mentally dispel myths. Like I like the way he put it. It's in your mind, but it's a lot of misinformation as well.
Right.
Yes.
And like my mom used to tell me when I was a kid, go find out for yourself.
Yes.
I don't want you to hear about what somebody else told you. I want you to come back to me and report what actually took place. And I use that model, and I when my interactions with my clients, my homeless clients, I explain to them that same the way I just explained it. That's the way I say it to them.
Yes.
People, the care will be geared towards you if you go in there and you be honest with the people. The intake is critical, and I tell them, if you go in there and you just trying to do this, and that, go in there and explain to this people, this is what's going on with me, and you'll get the help. And I've had clients that was actually had things wrong with them, but the fear of misinformation. What? You got to pay $100 copay. Where?
Yes.
Where?
Yep.
You know, let's go, and not making fun, just let's go and see. I'm going to show you.
Yes.
And when you do that, it open up the correct information,
Yes.
the avenue for correct information. And one of the things people cannot say in Hennepin County, that opportunity for you to help yourself is there. They can't say it's not there.
So I'm hearing from you both is don't listen to us talking today. Start taking the steps and see what happens.
See what happens. Yes.
Right.
And see what happens. And one of the things that specialty care, the different facets of Hennepin County making the move. The innovation is this amazing to me.
Yes.
Because if you're bold enough to step out front, that's what makes the difference.
Yes.
And Hennepin County stepped out front many a times. You know, so that's what I'm really impressed with. That like I said, people really care.
Yes.
Yep. See, what I like really about the Hennepin Health is my chart. I really like that. You know, you can learn everything about yourself right there. And when you go to the doctor, them will go in there. You're gonna look where everything been said.
Yes.
You can order. You can make schedules. You can schedule appointments. It's good, man. It's good.
Yeah. That ability to
Yeah, to
use that
talk.
electronic medical record, take
Right.
some information, share it with the people who need to know is a big deal.
Say like if you got a question, you don't want to go in, you got a question, they're gonna respond. They respond back to your question.
Yeah.
That's good, there, because ain't too many states got that.
Yes.
Not the ones I know of where I've been. They don't have it.
Well, I can't thank the two of you enough for sharing your story, because it's going to help someone out there right now.
I hope so.
Someone out there is seeking health care, seeking care, seeking the love that you both have spoken of.
Right.
And I think and know that hearing your words about take that action step is gonna get folks on that right path.
Right.
I think it is an incredible journey, and it says a lot about the two of you to be able to carve health care, to carve care out of the system, to find it, to take that action step. And so just my deep gratitude to the both of you for what you have done, and then what you do for community every day. I really appreciate it.
Right.
And I would like to personally thank you for, and like I said, when the realness is there, the measure of a man or woman, what you're doing when nobody looking.
Appreciate you.
Go to HCMC right now. There's a table sitting out front, and there's food on it for the community. Who does that?
Well,
So that's where it's at.
Yeah.
Thank you.
Proud to walk alongside you all and those healthcare providers and Hennepin Health and all those that are trying to promote health and really what we're asking of you, our community, is to take that action step. Our friends here have shared their story, and what a gift it is to hear their story. Now's the time we take that action step, and we can seek and get that love and care. We have spent this podcast trying to demystify Medicaid. But there's more you may want to learn. To learn more, you can go to MinSure.org. And if this show has been helpful to you at all, or if you know someone who could use it, who could take these steps, please take them, share it with them, like it, distribute it. Check it out at hennepinhealth.org/podcasts. Like it, love it, and send it out. Everyone has a choice of how they spend their time. The both of you have gifted us with your time. We're grateful. And you all out there have spent your time with us. Thank you for choosing to spend it with us. Stay well and be well.